On March 14th, I was aghast to learn that an Asian American family in Midland, Texas, was shopping at their local big box store when a man, someone from their own community, attacked them with a knife, stabbing three members of the family, including a 2-year-old and a 6-year-old child, and a store employee who had come to help them, and admitted that he did this because he believed that this family, simply because of their ethnicity, were responsible for the COVID-19 pandemic. The FBI categorized this as a hate crime and warned that there will likely be a surge in anti-Asian hate crimes in the United States because of racist scapegoating associated with the COVID-19 pandemic. Meanwhile, our own president, President Trump, has continued to insist on calling the COVID-19 virus the Chinese virus.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China.
Unfortunately, this kind of racist scapegoating of ethnic groups for infectious diseases is nothing new in U.S. history. In the 19th century, Jews and Irish and Italians were blamed for the flu or for polio. In the year 1900 in San Francisco, fears of a bubonic plague outbreak led to calls for Chinatown to be burned to the ground, and local officials went through the city streets, grabbing Chinese Americans off the sidewalk and forcibly inoculating them with experimental treatments for the plague. We are in the year 2020, and we know better. It is time to stop the scapegoating. So how do we do that? First, call on government officials, federal, state, and local, to stand up against racist scapegoating. No ethnic group is responsible for the pandemic, and officials know it and need to say so. Second, we all need to be in solidarity with each other. Asian Americans, like all other Americans, should be rising up with African Americans to say, what is happening with these disproportionate rates of morbidity and mortality in Black communities as a result of COVID-19? We should also be in solidarity with Native American and Indigenous Americans around the country who also are suffering from COVID-19 because of a lack of adequate health care and basic infrastructure like running water. We need to be in solidarity with people with disabilities who are at risk of the discriminatory provision of health care and medical interventions on the basis of disability. And third, and finally, we need to recognize that responses to the COVID-19 pandemic need to be based on science and the public health experts, not on politics and racial scapegoating.